Hello, and welcome to a conversation about COVID-19 vaccination presented by Eskenazi Health. I'm Tina Cosby, host of Community Connection on AM 1310, 92.7 FM, and 95.1 FM, The Light. And we're going to have a candid and informative conversation about the COVID-19 vaccine and the minority community. We have quite a distinguished panel of Eskenazi Health professionals who are going to guide us through this open dialogue, a dialogue designed to answer questions and address concerns so that you can make the most informed decision possible about the COVID-19 vaccination. So now let's meet that panel of Eskenazi Health professionals who are going to be with you for the remainder of our visit here. And as I introduce each panelist, could you please briefly tell us about yourself, your career, and exactly what you do at Eskenazi? And the first panelist I'll bring in is Dr. Maria Robles. Dr. Robles, how are you?
I'm great, thank you.
Great. So can you tell us about yourself, your career, and what you do at Eskenazi?
Sure. So I'm a primary care physician. I also have an administrative position at Eskenazi where I'm a chief physician executive over at West 38th Street. I've been with Eskenazi for about 10 years. I also have a special interest and focus on treating patients with substance use disorder.
Okay. Substance abuse disorder. Okay. All righty. Well, thank you. And welcome to the panel, Dr. Robles. We also have with us today, Dr. Amy Beth Kressel. Dr. Kressel, welcome. Thank you for joining us.
Thank you so much for this opportunity.
So can you tell us about yourself, your career, and what you do at Eskenazi?
So I'm an infectious diseases physician. I've been at Eskenazi primarily for about 7 years. Here at the hospital, my major role is in infection prevention and antimicrobial stewardship. And what basically that means is trying to keep people safe in the hospital by preventing hospital-acquired infections and also preparing the hospital for things like COVID. So it's a pretty broad role thinking about any infection that could affect us.
Indeed. And we also have with us Dr. Katasha Butler. Dr. Butler, welcome, and thank you for being here with us today.
Hi, good morning. Thanks so much for having us.
Thank you. So can you tell us briefly about yourself, your career, and what it is that you do at Eskenazi?
Absolutely. Thank you. I am the newbie in the crew. I am a pharmacist. I've been a pharmacist for almost 17 years. I've only been with Eskenazi it will be 2 years in July. I've certainly enjoyed my time there. And what I do is I work on regulatory compliance and med use process, which includes running the Pharmacy and Therapeutics Committee, deciding which medications we are going to offer at the hospital to treat our patients.
Okay, I'm going to follow you guys. So again, the overview in terms of why we're here, and again, that is to have an open conversation about the COVID-19 vaccinations. What are the different vaccines, who should get it, why you should get it, where to get it, how to get it, and what happens when you get it, and answer any questions and address any concerns that people may have regarding COVID-19 vaccinations. And those questions and concerns seem to come up with new ones with each passing week. But Dr. Kressel, you were telling us just a few moments ago before we went live that we should start with the good news today. So let's start with the good news right out of the gate. Let's have it. What do you got?
Well, what I was saying is that when the COVID-19 vaccines were first given emergency use authorization by the FDA, there was a lot of concern about whether the process was rushed and whether the vaccines were safe. And only a minority of people in minoritized communities were willing to accept the vaccine or take it. But we've seen the opinion polls shift as more information comes out about the vaccines and as more people get them and as more safety and efficacy data come out. So as more and more people see their peers get the vaccines and as more and more information comes out about how extremely well they work, we've seen those opinions shift. So in the Latinx and African-American communities right now, a majority of people actually do want COVID-19 vaccines. And I think that's great because I'm an advocate of them and I've received them myself. So I'm happy to see that.
So Dr. Kressel, what do you think is behind that shift? And if anyone else wants to weigh in on that, please feel free. But Dr. Kressel, I'll just go back to you in terms of what you feel is behind that shift.
I think it's probably multiple. We've got, again, more and more people are seeing people get the vaccine. There's an avalanche of the safety data of the vaccine. And again, I think maybe some of the messaging from our government has been more consistent. It could be a combination of things. I also think that thought leaders in the African American and Latinx communities have done a great job stepping up, getting vaccines in public. So it's probably a combination.
Yeah, we wanted to take this particular time to focus on the vaccinations and the minority communities. And to be perfectly honest, minority communities are the most impacted and the least likely or the least to be in line to receive the vaccinations. And Dr. Kressel was gave us some very good news right off the top. But let's go back. There is a concern about how we can catch up and how we can, just bridge that gap between those who are most impacted and those who need it the most to kind of even it out. So how did we get to that point right out of the gate? And I'll ask you to start it off, Dr. Robles.
Well, that's a hard question.
Okay.
I think, no, and I can take a stab at it. I think, if we look at the history of medicine, it really medicine has not done a great job in treating our minoritized population. And, I'm not going to sit here and give excuses for that at this point, or try and explain it all, but that's a fact, and people know it. There's more and more data and research going on right now in general, but there are still huge gaps in care. And so I think that, for some people, there's a distrust. And, a lot of groups, a lot of communities, a lot of physicians are working hard to try to gain the trust back of the communities that are mostly affected by this. Interestingly, when they studied the vaccines, the companies actually did a really great job in bringing in a lot of minoritized people. So when that vaccine came out, we did know that it was safe. The safety information was the same for different groups of people. So one of the things that we're doing at Eskenazi is we've spent years and years trying to build that trust up. And so when my patients come and see me, when it's a one-on-one conversation, it's very different than when they're hearing stuff blasted at them from the news. And so, I think some of the way that we can make that change is really elbow to elbow. And so also what Dr. Kressel was saying, that some of the big leaders and some of these other organizations have really done the work themselves. And I think that not only hearing from your doctor, but really seeing your mom, your sister, your friend get the vaccine. So having that spread within the community is, I would say, more important than, having other groups just sort of shout at people.
Yeah, leadership certainly, by example, I guess, followed by example. Dr. Butler, 3 different vaccines on the market right now: Moderna, Pfizer, Johnson & Johnson. What are the differences? How are they different? And what is it that people need to know?
Right. Well, of the 3, 2 of them, the Pfizer and the Moderna, use mRNA technology. What is important about that, as soon as people hear mRNA, they think it's altering your DNA, and it is absolutely not doing that. Those 2 brands require 2 doses, at least 21 to 28 days apart, and they are similar in efficacy. The latest that has just come out under emergency use authorization is the Johnson & Johnson, and that uses a viral vector technology. So using a cold inactivated virus, that one only takes one shot, and so you can get it and you are all set. And so each of them, the Moderna and the Johnson & Johnson, you could take it from 18 years of age and up, and the Pfizer goes down to 16 years old and up.
Dr. Butler, is there any research out there now that lets people know how long these vaccinations last? If the one-shot J&J, the Moderna, the Pfizer, do you have to get them again in 6 months? Do you have to get them again in a year? Are they lifeline? What's the latest on that?
Right. That information is still coming out. We are not entirely sure if this is going to be an annual vaccination like we are doing the flu vaccines, that information, they're still studying it and trying to figure out how long these vaccinations are going to last. Everybody has heard about, the different strains, the new strains, and do these provide coverage for it? And so that information still remains to be seen.
Yeah. So now that the entire state of Indiana, for the most part, adults 16 and up, have access to registering and getting the vaccine and the vaccination, how do you think that'll change the landscape that we're talking about right now? Or do you think it will change the landscape? Do you think it'll just stay along the same lines, just relatively speaking? Or do you think that that's going to be a game changer? And Dr. Kressel, you were nodding, so I'll go to you. I'll go to you first.
Thanks. Sorry.
Oh, that's okay.
The vaccines will eventually change the course of the pandemic. I think right now we're in a race because we still have, even though we're getting more and more people vaccinated, we still have a substantial number of people who are very vulnerable to COVID right now, and we can't vaccinate our kids yet. So and the virus is mutating. Every time it jumps to a new person, it has a chance to make a new version of itself that can cause more severe illness and be transmitted more easily. So we really are in a race. And yes, the vaccines are giving me tremendous hope. But we just have to be a little patient and work really hard to get everybody vaccinated as quickly as possible.
Dr. Kressel, I'm going to stay with you on this follow-up question. What's the more formidable foe, the vaccine, the variants, or the virus? What's the more formidable foe?
Well, the variants, some of the variants are spread more easily than the original virus and cause significantly more severe illness. So we're worried about the variants taking over right now. And again, that's another reason to get vaccinated more quickly.
Is it a race against time, variants versus the virus, and getting those vaccines? I mean, how's all that working out? Do we have time to beat the variants?
We do. It's kind of a good news, bad news situation because in the United States, the UK variant is the one taking over. So that's bad because it transmits more easily and causes more severe illness. But in a strange way, it's good because it's actually very amenable to the vaccine. But, if people drop their precautions and stop all the non-medical things we've been telling people to do, if they stop wearing their masks too soon, start having large gatherings too soon, the UK strain can certainly infect more people and send more people to the hospital. At the same time, the vaccines work really well against it. So I think part of my messaging to people is don't take off your safety belt yet. We're going to get people vaccinated. But in the meantime, these other strains are emerging and can certainly cause a fourth surge, I should say. And if you look at what's going on in Michigan, you see cases are increasing there. Not clear exactly what's going on up there. I won't promise that I know everything, but the UK variant is up there and it's certainly playing a role there.
Yeah. So in terms of what Eskenazi Health is doing to roll up the sleeves and get after all of this, where can people get the vaccinations? How can they do it? And who should be getting it? Now that everyone, from 16 and older, are there any people who should not? Where do they go? What can, so can you give us the picture from Eskenazi Health perspective in terms of what's going on?
So I can start with this one. So at the clinics, at all primary care clinics, we've actually been calling every single one of our patients to help them get scheduled. And, a couple weeks ago, we were helping them register on the statewide site. Now we actually have our own vaccines at Eskenazi for Eskenazi patients. And so we are scheduling them at their home clinic. They have decreased the number so quickly that, we're not quite caught up with calling everybody. But we do have those lists out and are working with that. And again, that's specifically for Eskenazi patients. People in the state who want to get vaccinated but aren't an Eskenazi patient can, call 211 or go to ourshot.gov to get scheduled.
So what is are you hearing? Is anyone hearing? And anyone can answer this one as well. the reasons why people hesitate. Is there any way you can explain that? And perhaps you can explain to someone listening or watching right now, this is exactly what you can expect. And so this is why you should relax. If you've made the decision, this is what to expect, and this is how it's going to go. So the resistance, why people tend to be resistant, what their most common concern is, and then what can they expect?
I can answer some of that. What I have seen and heard, and some of the things are unbelievable, but unfortunately, this pandemic started in a very trying political situation. And
Yes.
So the discovery, the rollout of the vaccines, and just the shroud of the different ends of the political spectrum, that just provided enough angst in the backdrop where people already have concerns about getting vaccines and immunizations. There's already a way, people who don't believe in that. And so I think that added to it. That is most of what I've heard, when we talk about African Americans and their distrust of the medical system. Dr. Robles kind of touched on that. And those are things that we just have to, inform and educate and get past. Even for myself as a pharmacist and a healthcare professional, when it first started coming up, I could even say that I had my own doubts and I'm not sure if I want to be the first one. Maybe I'll wait and see what happens. And this is coming from me as a healthcare professional. But as we just went and kept going, and I just saw the pandemic getting worse and more people affected, people dying in record numbers. You just have to trust science, take that leap of faith, and just continue to educate. I knew that if I got the vaccination, many people look to me, they trust me, they trust my opinion, and I had to be a leader in my own circle, not just at work or, talking the talk at work, but I had to do that in my own circle and the people who knew me, so I could get them and help them feel better about it, even down to my parents. I wouldn't ask my parents to do something that I wouldn't do myself. Mm-hmm. So I couldn't wait, frankly, when, I was eligible to get the vaccine.
Dr. Butler, and I want to expand on that a little bit. What can we say to minority populations to put more people at ease and I guess garner a little more confidence in the process, the vaccination, and just the system administering it as a whole?
I just always say we're often receiving the short end of the stick or, left holding the bag. We already have comorbidities. We already, have issues with the system. But if we don't take this vaccine, I just feel like it will end up worse for us. We're already not in the best position. Don't end up worse. My uncle, my mother's only brother, died from COVID, complications related from COVID. So this is somebody that I talk to every day, could reach out and touch, very young, and never would have thought it would impact my own family. But we have to have those discussions to not be left holding the bag. And so, because we already have the other issues that are coming up against us. And so when I work the point of distribution, so that's the vaccine clinic that is running at Eskenazi, I volunteer at least twice a month. When I work, I make sure that I tell everybody that I see, I'm so happy that you're here. Please talk to your family and your friends about getting this vaccination. I'm just very glad to see you, especially if they are in the minority populations, because I know where they're coming from and I get it. I've had to have these conversations with friends, family, my dad, he was my mother, much more convincible, my dad, not so much. But when we start talking about the issues, what could happen, what we have seen from COVID, it is just not like, a really bad flu. It is so much more than that. And you have to talk to people about that. And now, unfortunately, I can talk from experience not just, what I've read or what is theoretical. So we have to be very serious with these discussions.
Yeah, and some of the conversations that I've had on my show that I shared that have come to me have been from people who were skeptical or just not interested in getting involved in the conversation, getting involved in the process, just getting involved in any of it until they contracted COVID-19, until they contracted the virus. And then after they recovered, they said they couldn't wait to go get their vaccinations because they said they wouldn't want anyone to have to go through that or anyone to feel as sick as that. And perhaps if we could get more people to share that perspective, because there were two people I know of that shared that with me personally that said, hey, had I not had it, I wouldn't even be, but I can't wait to get in line once the list is expanded. Have you found that to be common?
I would probably say so. Most of the people who I've, who have met and talked to, who hadn't been necessarily hospitalized but had COVID, I just think that it is, the worst. They couldn't even, you can't even put it into words how people are feeling. And
exactly.
I'm not, I don't want to have to go through it to make a believer out of me. I believe you, just by the data and what we have seen. And so, we just need to keep talking and getting the information out there, even for our younger people who are still gathering. Spring break is coming up. Everybody has excitement for 2021 and getting back out there, but our younger population who may not think, at the beginning it was like, well, they weren't as susceptible to getting it, or the progression of the disease may not be as bad, but they need to be protected too. They are not invincible, and we need to be reaching out to our younger population just as much as we are with the older populations with the comorbidities.
Yeah, especially now that the eligibility for the vaccinations has expanded all the way down to age 16. The other thing that I hear discussed a lot in minority communities is there's really a difference between which shots you get, and you're going to get sicker with this one and you're going to get sicker with that one, or what have you. There has to be a commonality among a lot of them, though, correct? Not one's not going to make you sicker than the other. I guess Dr. Butler. Yeah. Is one going to make you sicker than the other, Dr. Butler?
Well, all vaccines, they have the standard side effects that are listed, sore arm, malaise, chill, fever, any of those things could happen with any vaccine. What I have seen anecdotally, and maybe Dr. Kressel may know more about it as our ID specialist, what I have seen more side effects from is from the Moderna. That's just anecdotally, but I just tell people whichever one is available, that's the one you get. Don't try to finagle and wait and I only want this one. If it's available to you, whichever one it is.
But it's, yeah, that's it. So if you have a reaction after your first shot, should you expect a reaction after the second? Because a lot of the a lot of the chatter has always been around usually the second shot, the follow-up shot.
Yeah. Dr. Kressel, what do you think?
Yeah, the data does show some of the side effects are more severe after the second shot, although I should be careful about using the word severe. It's
more
not
pronounced. Yeah, more pronounced.
Right, more pronounced. You're not going to go to the hospital, right? We're talking about side effects that you may feel not great for a few days, but after a few days you will feel better. And the really common side effects, the sore arm, the achiness, the tiredness, people can take Tylenol for those things, and Tylenol works really well. And then after a few days, you'll be fine compared to the fact that COVID could land you in a hospital. It could kill you. Some people have long-term side effects from COVID. You could lose a family member if you get COVID and you give it to them. So yes, there are some side effects from the vaccine, but I think we really have to put it in context in the big picture.
I was told by, because I had the J&J vaccine, and the following day I had fatigue like I'd never had before. It was almost funny. I had to laugh. I was like, this is weird. This fatigue that I'm feeling is really weird. And so my nephew, who had contracted COVID, said, okay, multiply that times 100 and you'll know what I was going through. He said, you just had it for a day, multiply that times 100. I'm like, are you kidding me? And he said, oh no. But folks, is there anything that people can do to put them more at ease, to prepare for taking the vaccine? Because sometimes folks need to know what lies ahead or what they can prepare for. So Dr. Robles, is there anything that we can prepare people for as they embark on getting their vaccination?
Yes, I do want to jump back real quick just to add,
Okay.
There was a statistic, and I don't remember it exactly, but it's something around when talking about trying to talk to people who are hesitant about the vaccine,
Mm-hmm.
that I believe it's 95 or 98% of doctors jumped at the opportunity to receive the vaccine. So the very first time that they were offered it back in January, I think it's 98% of them went the very first day they could possibly receive it. So, you have your entire workforce of physicians who are, believe in this and, feel that it's safe enough to receive themselves. So I hope that that's, powerful to people. And, we're not just telling people to do it because we think it's good for you. We're doing it too. We're all wearing these buttons. We're all convincing our own parents. So we're right here with everybody too. In terms of preparing for the vaccine, at this point, we aren't recommending that anybody pre-medicate with Tylenol or ibuprofen.
You're saying don't do that?
So we aren't right, correct. So do not take Tylenol or ibuprofen prior to the vaccine.
Oh,
It's sort of something that's changed over the past 5 or 10 years. I think we used to recommend that for children, but at this point, we are not recommending that. If you take the vaccine and have some symptoms, people are welcome to take those medications to help. I have heard some people saying that they often will try and take the next day off of work after both the first and the second dose or the vaccine. We're not necessarily recommending that. If you have the ability to do that and it's easy, I would say, hey, why not? If you absolutely cannot do that, a lot of people are still able to work the next day. If you have a really strenuous day ahead of you, that may be the type of job that you may want to, take a half day or just, tell your boss, hey, I may be a little late, or maybe, could I be put on a job that's maybe not so strenuous the very next day. But again, not everybody feels really tired the next day. It is fairly common, but it's not, it's not something that's happening to everybody.
Yeah. So a couple of quick things. Schools, is it safe for schools to be back in session? And the other question that has come up is it safe to have the vaccine once you've had COVID, or how long after you've had the vaccine should you have it? So
Do you mind if I answer?
No, I don't mind at all. Go ahead, please.
Yeah, so it's actually recommended to get the vaccine after COVID. You can wait. You're probably protected against getting another infection with COVID for at least 90 days. So you have the option of waiting those 90 days before you get the vaccine. However, you don't have to wait. Some people,
Okay.
yeah, and some people have said that, yeah, the vaccine, maybe you get more noticeable side effects from the vaccine after you've had COVID.
After you've had COVID, okay.
But I don't think we have a good handle on the numbers there.
Okay.
Those are just individual people saying that. I think there's such a wide range in the symptoms people get after the vaccine that it's really hard to say. I will again stress that, people like to say how tired they feel after the vaccine. I was tired after my vaccine. I had a slight headache. I had a sore arm. I had just some like muscle and joint achiness. But other than the tiredness, nothing that Tylenol would not fix.
Yeah.
And
Or a nap.
and everything was fine by 3 days, even after my second dose. So I think it's really important to put this in context.
You know,
Well,
go ahead. Go ahead.
yeah, people will get a very red arm, like exactly where they were injected. They get redness there a week after the vaccine. But that also is not a serious side effect that goes away. So I just want to put it in context. And I think a question came up, who should not get the vaccine?
Right.
The only people who should not get the vaccine are people who have severe allergies to the component. There have been very, very rare severe allergies to the vaccine itself. But we're talking about like 5 in a million people. And we haven't found another category of people who can't get the vaccine. And in fact, there was just data recently released about pregnant people getting the vaccine, and it worked for them. It worked very well for them. Their babies got antibodies, so they got some protection from the vaccine, and it was very safe. So again, if you can get the vaccine, if you're 16 or older, you should get it as soon as you can. And in Indiana, you can get it.
Yeah.
Sorry, that was not your school question.
Well, the school question about school children ages, I guess 5 to 16, is that safe? They cannot get it yet and may not be able to get it for a while. How safe is that for them to be in a school setting? Are they, carriers? I mean, are they, what's the status there?
Right. So CDC has a rather long guidance document about this, about ways that children can get back to school. We've learned a lot about this pandemic. It seems that if schools enforce mask wearing and have really good policies that people don't go to school sick, it should be relatively safe to restart in-person class. There's always concern about how much COVID is in the community. If you have a very high community incidence, you might have to do things differently. If schools are vigilant and if they make sure that they're monitoring students and teachers for cases of COVID, informing anybody who is near those teachers or students, and really making sure everybody wears a mask and wears it properly, CDC has endorsed going back to school. That there's a lot of complication there, but that's the general thought. And I think maybe Dr. Robles could speak more to this, but there are concerns about what happens when we don't have children in school. They don't have access to free lunches. Nobody can see if they're being abused. Not all students have access to the internet. So distance learning can be hard. And there was just a study that came out about the mental health impacts on children, that there's more depression if you're not in class. So it's really a complicated balancing act.
Yeah, indeed.
I was really just going to echo that. I have 3 kids in elementary school and in IPS right now, so I feel like I'm sort of in the thick of it. And I think this is a bigger question than something that physicians and healthcare workers can answer. I think because this has far-reaching socioeconomic consequences if we keep our kids out of school. And the reality is that the people who are most harmed by it are the people that are working jobs where they can't work from home. Grocery store workers, folks that pick up the trash. And so to say we're not sending anybody to school because we need to keep other people healthy, it's really complicated and layered. And so I think that's a bigger discussion that maybe having a bigger panel of folks on the call may be warranted at some point. I did just want to comment quickly on hesitancy in folks that are a bit younger. You mentioned something earlier about people being more willing to get the vaccine once they've had COVID. I unfortunately have actually seen the opposite happen as well.
Really?
I have. So, there are people that get it, don't have a lot of symptoms, and then sort of think that they're, a superhero. I've also, and also, there's a newer report, and Dr. Kressel can sort of speak on this as well, that, we think that 1/3 of cases are asymptomatic at this point. So, there's a big group of people who are going to, if they get regular testing, are going to test positive for it, never have any symptoms and say, hey, I'm okay. And I think the messaging to those people is, your parents, your grandparents, we need you to do this. And, because the people who are younger aren't getting as sick from it. They can, and there can be awful consequences and, long COVID as well. But the percentage of people that are getting sick from it is lower in the younger population. But we really need them to remember who raised them, who's still there for them, who's, giving them dinner and letting them wash their clothes when they come home.
Yeah.
We really have to think of society as a whole. And really, I can't tell you how many people I've heard say, what if I get it, I'll be okay. And I look at them and say, you might be right, but your grandma won't be, And so I think that we really have to think of each other when thinking about the vaccine.
And this is for any of you. We're more than a year into this. Are any of you surprised, or what are your thoughts that we're still having this conversation a year into this, pretty much like we were having the conversation a year ago? What are your thoughts there? I guess I'll start with you. I'll start with you, Dr. Butler.
I was just having this conversation not too long ago about the simple question of how are you doing today? What I want to say is, oh my gosh, I'm exhausted. I'm just tired of, I just feel drained, and this whole reality is weighing on me. But I don't want to, we don't always want to, I speak life in my words. I don't want to say that, and, I'm out, oh, I don't feel this. But I think we have to acknowledge the mental impact of being in this environment for over a year. When this started last March, no one thought that we would still be here in the same space a year later. And Dr. Robles talked about the kids. What have they lost without being in school for a whole year? And so, we have to just acknowledge and give people grace, because it's heavy. Even if you haven't experienced COVID, lost anyone, we have physicians that are treating these patients. They're seeing the worst cases. It can be very heavy. And I think that it is on us to make sure we are acknowledging that and giving people the help and resources that they need, because it is a lot.
It is. And Eskenazi, again, just has a wealth of resources and so much support that the health system is offering. And before we wrap up, I want to get to that. I want to have each of you share a little bit more about that. But I had a question. I wanted to roll back on when you should get your vaccination. What about scheduling your vaccinations on a day when you don't have to go to work the next day?
That's reasonable, but as Dr. Robles said, it's not necessary. It
Not
depends on your
necessary.
job.
Okay.
Depends on your job and how much physical exertion you have to do in your job, I think, right?
Yeah.
I think it's a reasonable thing to do. And, our vaccination sites are open. They have really pretty broad hours. So you might be able to arrange getting the vaccine on a particular day. I will say that we scheduled one of my family members yesterday when the site opened up for age 16 and above. So there's a large demand now because now really anybody 16 and over can get the vaccine. So for the time being, you may not have as much availability for particular days. So I would still say, again, because we have variants on the horizon, we see what's going on in Michigan. Cases are actually starting to rise in Indiana after having dropped for a while. So I still would urge people to get it sooner instead of being very particular about days or the type of vaccine.
Okay, that makes sense. And so 2 weeks after your last vaccination or 2 weeks after the J&J, you are considered fully vaccinated. Is that still the case?
I will be a little picky here.
Okay.
Actually, you're Yes, it's 2 weeks after the second dose of the Pfizer or the Moderna vaccines. But actually, your immunity keeps improving. So I would say 28 days after the Johnson & Johnson vaccine.
Oh, okay. Yeah. Before we go, again, the wide array of support, the support system that the Eskenazi Health Systems has for vaccinations and to make sure that no one gets left behind, that there's an opportunity for everyone, especially minority groups, which are lagging behind. I'll let each of you go ahead before we close and share what our listeners and our viewers need to know more about. Dr. Robles, we can start with you.
Yeah, so as we start off, we are calling all of our patients to help them schedule. We also are able to schedule some people same day. So when people walk in, if we have a vaccine available, we say, hey, would you like the COVID vaccine? We also have a really robust mental health system here at Eskenazi. So just in terms of effects from the pandemic. I've seen more depression this year than I have in my previous, 9 years of practice. So we're here. We're happy to do phone visits. They're sometimes easier for people who can't get in. So if anybody wants to schedule, they can actually call the main line and say, I want a phone visit, and we can get those scheduled. We're also available here to talk to anybody who has any sort of hesitancy. We have really well-trained nurses who are answering the phone, or if somebody wants to speak with a provider directly, we can make that happen too.
Indeed. All right. Thank you, Dr. Robles. Dr. Butler.
I would say, I'm just really happy to work for an organization that is taking this very seriously. We have had town halls with different groups and different organizations and outreach to minority populations. And we have providers who are really invested and really care about the success of the population that we serve. And so I just would urge everybody, if you are able, please sign up, please get the vaccine. I've only heard compliments for anybody who comes to the Eskenazi pod to get vaccinated. And so we are just happy and willing and waiting for you to come through so we can serve you.
Okay, and Dr. Kressel.
I've been really so honored to be part of Eskenazi in terms of how we took care of people in the hospital who had COVID. All the physicians, pharmacists, nurses, respiratory therapists, the whole team really pulled together. We had really a huge surge of patients early on, as you know, and another surge in the early part of this year. And we completely, we were expanding our intensive care units. We pulled together more teams of physicians to take care of patients. The pharmacists and physicians work together. There was an avalanche of information coming out about treatment. I mean, some people may recall how every day it seems like something new came out about how to properly treat people who have COVID-19. And we kept up with all of it. We changed our protocols sometimes weekly to take care of people who were in the hospital under our care. And we really had really great outcomes compared to other hospitals. So I want to put that out there. And at every step of the way, we thought, okay, how is this pandemic affecting our patients? And what can we do? When patients transition to telehealth, we were worried about vaccines, especially influenza vaccine, but other vaccines. So the Eskenazi Health pharmacies can give any vaccine people need. So we can give measles vaccine, we can give influenza vaccine, we can give hepatitis vaccines. And in fact, our emergency department pivoted to give more vaccines to people coming there because we knew that might be the only time that they were there in person. So the whole organization has really pulled together and thought of things to do, not just for people with COVID, but all the other things that people still have that need to be treated. And we're completely open for business. If you are sick, come to us, come to the emergency room, come to your physician's office. We are open and we're ready to take care of anyone who needs help.
And we're reminded that we should not forget about our homeless populations as well, which are being taken care of as well. The homeless populations? Yes.
Yeah, so there's been an outreach where a couple of provider and a nurse, I believe, are going out and giving the J&J vaccine to folks that are unhoused right now. The one other, thing I have to say is, not only has Eskenazi thought a lot about the patient population, but they've also really worked with their employees. So, we have a lot of employees here that have also had issues with, childcare is closed, schools are closed. So we do currently have free childcare for employees. So they've, tried to make sure that everybody working here is able to come to work and, there's food pantries that are available for the general population, but also for employees if they need those, as well as childcare.
And for people who want to get in touch, phone number, website, addresses, where can they go? What can they do?
I think the easiest thing is our website. There's a button on there that says schedule an appointment. At Eskenazi, we are, again, just vaccinating the Eskenazi patients at the clinics. At the main hospital, it's one of the sites where anybody can register and get vaccinated. But we are also still taking new patients. So, if you say, hey, this sounds great, I want to be a new patient, we can, go on that site, just click the button, I want to be a new patient. There's also the main Eskenazi number, 880-0000, I believe. Somebody wants to correct me, okay?
Well, close enough. You got it. Doctors, eskenazihealth.edu, I'm told, is another website that we can use. So, Dr. Robles.
If people still need to schedule their vaccination, it's ourshot.in.gov.
Yes, ourshot.in.gov. Or can they still call 211 as well if they're not familiar with how to navigate the internet?
Correct. 211 still works as well.
211 still works. Okay. Thank you all so very much. Our panel of Eskenazi health professionals, Dr. Robles, Dr. Kressel, Dr. Butler, you all have been absolutely wonderful. And I've learned a lot. And I hope that everyone watching and listening has learned a lot as well. Thank you for all you've done. Thank you for all you are going to be doing. Thank you for all you're doing. We really appreciate having you here with us today.